Hi, everyone. I'm Tori Dunnan, and I'm here with my colleague, Arthur Mondale, and we're talking about a very important topic right now about vaccination efforts in Black communities and an orchestrated effort that's happening in Palm Beach County right now. Real quick, we want to introduce everyone who's on this panel. We have a lot of different information and insight. So, quick example for an introduction, I'm Dunnan. I'm an reporter at PTV. Arthur, you go ahead.
And I'm Arthur Mondale. I'm a reporter at WPTV.
And jump in, guys. Introduce yourselves.
I'm Dr. Tiffany McCalla. I'm a board-certified emergency medicine physician and physician owner at Calogenics, and I'm representing T. Leroy Jefferson Medical Society, where I'm currently serving as president.
I'm Gregory Seabrooks. I'm a Palm Beach County resident, currently a senior studying at university. I'm happy I'll be graduating in a couple days, and this is just an issue that really connects to me personally.
Hi, I'm Sean McCray, infectious disease nurse practitioner, and I'm representing Palm Beach County Black Nurses Association.
Hello, everyone. I'm Malcolm Summons. I'm a resident here at Revere. I'm also a journalist and with T. Leroy community passing. How about you?
I'm Tony Drake, senior pastor, St. James Church, also congregational organizer of Faith in Florida.
And I'm Katonga Kimino, infectious disease physician, task force lead, the T. Leroy Jefferson Medical Society.
All right, so I think we got everyone introduced there. And if you noticed, some people are still at work, hard at work, dealing with COVID in our community. So thanks for taking your time, to talk with us about this important issue. I'm going to let Arthur kind of kick things off.
Well, yeah, I really want the public to understand that the ball has been moving on a conversation like this. Months ago, before the vaccine was even introduced, there were a lot of studies on who would get the vaccine and who would not. And so back on December 22nd, I did a story based off a Gallup poll that found that whites were more likely than non-whites to be vaccinated, even though Blacks were more than 3 times as likely to be hospitalized and over 2 times as likely to die from COVID. And it was all tied to a lot of bad history. And so I want us to play this video that I did back on December 22nd and really look at how far we've moved forward since then. Take a look.
In many Black neighborhoods, the resurgent demand for equal opportunity still visibly echoes. Yes, because the Blacks are a monolithic group, opinions vary from age to religion, issues including the COVID-19 vaccine. It's all the Tuskegee because of what happened. Alabama native Harrison Moore is referring to the 1932 Tuskegee syphilis study, a 40-year study that rocked the American medical establishment. A panel who reviewed that study found hundreds of impoverished Blacks were misled, not given adequate treatment or penicillin for the disease. It also led to the government paying reparations to the living participants and their families. The ripple effect exists today.
The Tuskegee syphilis study was why I chose to work in underserved communities.
Dr. Yolanda Hardy, Palm Beach County School of Pharmacy assistant dean and associate professor, says the study created a culture of medical mistrust and hesitation.
It was definitely real. And then we also have situations like Henrietta Lacks, where her cells were being used without her or her family's consent to continue doing research in cancer.
Dr. Hardy wants to remind the public there's been sweeping changes in both policy and regulation, but she also wants more historical understanding and awareness from providers.
Because that's going to help start the communication between the providers and the patient, so the patient can be able to ask questions so that they can start to make a decision that they feel is an informed decision about what they want to do.
That's the solution, is being well informed.
This is a death in life situation. Arthur Mondale, WPTV, News Channel 5.
So side to the Tuskegee syphilis study. Okay, so that was just months ago. Now, looking right now, we have 3 vaccines rolled out. Tori, has things changed? I think that's the basis of today's conversation.
Yeah, so Arthur and I kind of started talking about this and where we could go in terms of following up on this story. And so what we found out is there's an orchestrated effort in Palm Beach County right now. It's from nurse associations, it's from the T. Leroy Jefferson Medical Society, canvassers, everyday people who are working together to combat misinformation and put information out about the vaccine. So let's play that and then we'll talk.
Got to be ahead of the curve.
Dr. Tony Drayton walked the streets of Riviera Beach.
I walked out down the street and began to talk to folks who look like us.
He's the pastor of St. James Church.
There's a hesitancy of taking the vaccine.
Do you feel like this is part of your job as a pastor?
We have a moral and an ethical obligation to be as safe as we can. As a pastor, yes, because it's a part of what we do as we service humanity.
On a mission to educate and inform about COVID vaccine safety.
I certainly understand the lack of trust of government and political system among Black and brown people. Our history gives credence to that.
Dr. Drayton points to another turning point that escalated already present skepticism. The pause in the Johnson & Johnson vaccine, is that something that you think is really going to affect Black communities?
Oh, definitely, yes. Incontrovertibly, yes.
Let's stop doing your tracks.
Yes, it did. We've been oppressed. We've been marginalized. We've been disenfranchised as Black and brown people of our community. But now we need to get the information out of the importance of right information.
It's an issue that the T. Leroy Jefferson Medical Society is taking on. The group of healthcare professionals focuses on underserved communities in Palm Beach County.
Especially since Johnson & Johnson, we've got to, make up a little ground, because I think we lost a little ground on, some of our outreach efforts and things like that around the vaccine with people of color.
Outreach efforts now amped up to deliver a simple message. The vaccine is safe and effective.
I ran into a 13-year-old who told me that her family was afraid to get the vaccine because they thought they would die if they got the vaccine. And so we're trying to change that messaging.
Public service announcements, bus wraps, word of mouth targeting specific family members.
We have programming specifically targeting moms who are pregnant right now, but just in general, we find that moms are doing the shopping in families, and then also they help make those health decisions, and they're the ones who will say, hey, you need to go to the doctor to dad or the kids. So they really hold a lot of power in the family.
They believe there's also power.
And I had to say my goodbyes over FaceTime to my father.
In personal stories.
I don't think I necessarily understood all the way how serious it could get.
22-year-old Terrell Seabrooks from West Palm Beach now works with T. Leroy Jefferson Medical Society to share his story.
Those percentages that we hear about, and we talk about how rare it is, it became a reality for me. On August 26th, when I lost my father to complications with COVID.
Turning pain into purpose.
One of the happiest days of my life was followed immediately by one of the hardest days of my life. The last conversation I had with my father, the last real one I had before he was admitted to the hospital, was to tell him that I had been accepted into law school.
Now, before he heads off to Harvard Law, he's spreading a message of love through vaccination.
The impact that it can have on a family is devastating. So it's about really hoping our community understand that getting the vaccine is necessary. And he definitely would have wanted me to speak out about this issue, and he definitely would be proud, I hope, of the work that I'm doing as well. I know he was proud, when he was here.
Canvassing is a big part of this campaign. That's where Malcolm, who lives in Riviera Beach, comes into play. Malcolm is a canvasser. What are you out here doing today?
Well, basically, I'm going door to door, knocking on doors to make sure, urging people to stay safe during COVID, knowing that there's vaccines out, but we still have information as well as some masks and sanitizer to make sure everyone is still safe.
This afternoon, Malcolm says he's going to be hitting this neighborhood here in Riviera Beach.
Well, we handing out this stuff in the community.
All right, thank you, appreciate it.
Do you think this is effective?
Yeah, I believe it's very effective. A lot of people in the neighborhood like interaction, face-to-face interaction.
What's your name?
Malcolm.
Yo!
Knowing that I'm able to see them face-to-face and tell them these things, they're able to ask questions that they have.
There's a general sense it's that human interaction,
real stories from trusted individuals that matters.
Thank you so much.
We are an organization of women of color, and we go out and educate.
Rashawn Ridley McCrae is the head of the Palm Beach County Black Nurses Association.
The main thing is educate, educate, educate.
The infectious disease nurse practitioner says the hesitancy is real.
It's a big problem. It's a big problem, but it needs to be solved, and I think it can be solved. What I'm hearing from people is they are scared. They don't want to get blood clots. They don't want to die, and they don't know the long-term effect of it. I just let them know I got vaccinated in January. I had no issues with it since I got vaccinated, and they can look at other people in their family as well too.
It continues to affect, disproportionately, African American and Latino populations in Palm Beach County.
Dr. Katanga Camino,
You may get some injection pain.
an infectious disease specialist, says younger patients are coming in.
We're really worried about the younger people. They're the ones that are out and about.
Tackling the complacency is not so simple, he says.
When someone comes and says all of a sudden, well, we're going to go ahead and just ask you to go ahead and get vaccinated, because of our lack of healthcare, because of our knowledge about science, or our knowledge about how this whole medical system works, or the lack of people that look like me telling them that it is a safe vaccine. When those things aren't in place, I think that's when you get this hesitancy.
Now being confronted on multiple fronts in an effort to turn that hesitancy into herd immunity. Tori Dunnan, WPTV News Channel 5.
So first of all, I want to thank everyone who's involved in that story. And then kind of just the first follow-up in terms of, we'll keep it a broad question. Do you think strides have been made recently? And go ahead, anyone who feels like they want to jump in on that.
So I do think strides have been made in this effort to vaccinate. The most important thing is that everyone is still focused together and focused on either. I think that's actually one of the important things that we can do as a community. We, as T. Leroy Jefferson, have been involved in numerous vaccination projects around the county. And I do think that seeing people that reflect what you look like in your experience really does help break down some of those barriers.
Terrell, I kind of want to ask you a couple more questions about, why you, aside from the obvious reason, you're really devoting a lot of time now to this topic. It's, you're passionate about it because you lost your father to COVID. How can you get people to hear your story and take action?
I think for me, things became personal when my family was affected, my father was affected. Those facts and figures that we hear about, those are real people. And in this case, it was my father. And for me, I just know how real of an impact it can have. And, I took this disease seriously beforehand, but you learn a lesson about how serious it is when you go through something like that. So for me, the one thing I just fear is that other people will have to go through what I had to go through. And that's why I think if my story maybe can help somebody understand how difficult it is to see your loved ones hurt by this disease, how difficult it is to see family and friends go through that loss, I'm just trying to share that story so other people can hopefully avoid that pain. And I understand that you have to meet everybody where they're at with when it comes to the vaccine. There's lots of questions to be answered. But for me, I turn to the people who have the answers. I look to the people who have the answers, and I trust the people who are telling me they've been devoting their life to this, to studying these types of diseases. So really for me, it's just trying to prevent the type of pain that I felt, having to go on for other families in my community as well. That's just one of my biggest motivations.
Arthur, I don't know if you want to jump in with a couple questions too as well.
Yeah, so to the medical experts, is it broad hesitation? Is it lack of education? Is it bad history? Or is it bad numbers? And I know I'm putting a lot of tenets here out at you. But I first want to start with this because in that story that Tori did, someone said the hesitation is real. Okay. And then I got some data. Okay, so the Kaiser Family Foundation had reported that 8% of Blacks have been vaccinated. They represent 17% of deaths, and then 16% of population. And then 78% of whites, only 56% of deaths, 75% of the population. And then Hispanics, 25% vaccinated, 25% of deaths, 27% of the population. But then at the same time, I pull up data like this. Carnegie Mellon is saying that Blacks are less likely to report that they have been vaccinated. So whose numbers do we believe? And then what are you all seeing? Are we not being vaccinated at that wide of a gap?
I think I just remember this, Arthur, from talking to Rashawn. Rashawn, you talked a lot about how people are now getting vaccinated and they don't want to tell people because they don't want to deal with the fallout. Can you talk about that a little bit? Because I think that falls into Arthur's question.
Yes, that's what I've been seeing. A lot of people. I even have friends that won't tell no one that was vaccinated because they don't want to get the backlash. And also they say they feel like it's nobody else's business that they got vaccinated. So that's where I think we stand right now. A lot of people is hesitant to tell the people that they got vaccinated and that it's they had no side effects and they doing fine with it.
Okay, so should we believe the numbers, the way they look, or are they exaggerated?
I think we should believe the numbers. Some might be exaggeration too as well. So it's kind of hard to say. All depends what they got the studies from and what area they was in getting the studies from.
And then when we look at right now, so those aged 12 to 15 can now get a vaccination. The fact that the Black population isn't getting vaccinated at the rate of others, what impact does it have on their kids? Are you hearing from parents who don't want the vaccination, but they will allow their child to be vaccinated? Now that you have more school districts that are now going into this mask optional phase, are we worried about the upcoming school year?
I know, Dr. Some of the doctors on the panel, you guys wrote a letter today about this, right?
So Dr. Katunga in the letter.
As part of T. Leroy Jefferson. Yeah, so basically to address those issues, specifically, one, make sure that the mask was continued, which thankfully the school district has agreed to do through June 18th, which is the end of the school year. Two, also outline what Mr. Mondale mentioned, which is the fact that we have large under-vaccinated groups still in Palm Beach County, right? And so we know that people in their 20s, 30s, 40s, and early 50s are in the under-vaccinated group because 2/3 of the people in Palm Beach County that were vaccinated are 55 and older, right? These are people who don't have children, are not child-rearing families, so to speak. So in order to get to where we need to get to as a county, I think it's important to continue mask wearing as we discussed, the vaccinations, which have now opened up for the adolescents. And I just want to go back to what Rashawn was hitting on. Yes, the history has made the hesitancy, more prevalent. This is true. But there is a narrative out there that Black don't want the vaccine, which is not true. When we sit down and have these conversations with people that look like us, the more we educate, the more we encourage, the more we empower. And we've actually seen more and more people willing to get the vaccine. And so the goal is to continue to do that and to things like this and our pods and our meetings to try to get as many people vaccinated in those areas where we haven't so far.
To the parents that are still hesitant, who have children, I think the question they have from our medical experts, are you going to allow your children to be vaccinated?
An 18-year-old, and my 18-year-old got the Pfizer vaccine. 18-year-old is signed up for tomorrow.
I
All
have a
right. So
3 and an 8-year-old, and they do go to schools. They go to public school. They've been in school the entire time. Um, they do wear masks. And I do think that's a very, very important thing for anyone that has had a little child. Everyone knows, and this is, I know, not what this story is about, but the children are not getting sick as much as they did. And also the hand hygiene is really, really important. When these vaccinations become available for younger children, I do think it's important that we all really, take pause and listen to the medical experts, and, you can ask your friends, ask your neighbors. A lot of people have been vaccinated, and we're all fine. I got vaccinated in December.
Dr. Drayton, I kind of want to throw a question your way because, this is something that you're talking about in your sermons, and, you told me you're walking the streets trying to have conversations. Are you still being met with misinformation?
Yes, certainly a lot of misinformation. I think that's the part of the blowback that we're receiving by those who are resisting being vaccinated for COVID. And I believe that a lot of the misinformation can be addressed through education. I think that's primary for me. The education is a modulum that can change mindsets. And so, from my perspective, I was reminded just today that if I show every Sunday I have a captive audience, they're not asked to come, they come. The next Sunday there's another captive audience. So those who are in the synagogue, the mosques, the pulpits, or what have you, we have a great responsibility and a challenging obligation to educate, but also try to, I would say, influence as well for the safety of others and our safety, the importance of being vaccinated.
All right, Malcolm, I want to throw a question your way because, I found it pretty interesting being out and about with you in Riviera Beach. I think that's one of the neighborhoods that you go to, but you talked a lot about the human interaction and it's a way to reach people, but you're doing this on your own time, right?
Right.
So what inspired you to do that, and what are you hoping to do?
Well, one thing is usually in Black neighborhoods, there are not a lot of people that want to walk these neighborhoods and to put information out like that. So when I'm granted the opportunity to do so, and with my profession, I do this all the time, talk to people, interview a lot of people and things like that. So I have no problem walking and interacting with people because I'm always in the community. But the information that I'm able to get from these professionals and these doctors and things like that, and to be more educated myself, and then be able to educate my people that I grew up with in my neighborhood and things like that. So because we wouldn't have known. Usually sometimes when I go into these neighborhoods, people, they're shocked that I even have masks and sanitizer to give them. So just going there, and then now you may have one street that go down, and then you go down another street, even though they're all in a block, nobody, like we said, they're miseducated, and they're unaware of what's going on, the importance of staying safe and things like that. So I mean, when I'm walking in the neighborhoods and knocking on doors, when they see someone like me, a young Black male that is, and they're shocked, and sometimes I get a lot of questions. Where do you get these masks from? Where do you get these sanitizers from? And who do you get them from? And things like that. But after they understand why I'm there, then they're more comfortable, and they're more comfortable to listen to you. A lot of people don't want to listen because they don't know who you are. So when you approach them the right way and know how to approach the people the right way, then they'll sit and listen to you, and then they'll take what you said into perspective, and then maybe they would try some vaccines or make a different decision, or at least listen. So it's always great to talk to some people, and then finding out that they're just miseducated, and then they have a lot of questions. Like I said the news package, these people are, they're unaware. So, that interaction, me going face to face with them is just, it's better for them, because I don't think they will go out their own way to want to know what's going on.
Does the fact that the age is now being lowered for the vaccination change how you will conduct your outreach? How exactly will you target, I guess I'll use the term, the family, to ensure that these families are vaccinated collectively?
I know one thing I would say is walking door to door is beautiful, but I also take the opportunity to go to events that may be going on where people are together with their families and people are there with their kids and things like that, and speak to them while I'm out in their community. Sometimes some events are going on, so I stop by the events as well and talk to them like that. So you're able to reach them, their families all together, and be able to talk with them. So because sometimes they're not home, so you're knocking on their doors. But if you reach in there, go to some events that may be going on in these communities, and you're able to reach more people.
Dr. McCullough, can you talk a little bit about what Leroy Jefferson Medical Society is going to do, given the fact that they have lowered the ages for the vaccinations? I mean, I know, when we did this story, we talked a little bit about that targeted approach towards moms, being able to bring in the most people to get vaccinated. Does that, I guess that still holds true, right? Or is there a different campaign coming?
So absolutely, moms are super important in the communities. In general, though, T. Leroy Jefferson has a very unique position just because of who we are. So it's essentially a group of physicians and other healthcare providers that are, actively advocating for and educating people in the county, primarily people of color. At this point, we actually have conducted multiple vaccination education activities and events. So we've partnered with other organizations, but upcoming, we actually will be giving the vaccines ourselves. So we'll have a staged, once a week offering the vaccine to people, and we will have that opportunity to be able to educate and make sure people really understand the benefits and the necessity actually of getting the vaccine. Additionally, the Health Council of Southeast Florida is now conducting a focus group of young adults. And so that's going to be really, really important as well, to really get these young adults involved. So in my mind, I'm young, but the reality is, I'm not 18, right? And so when you are younger and the ways that you communicate, the people that you interact with are different. And so we're actively working on that. So anyone that's interested, please stop by our website and register. We'd love to have you involved in the focus group so we can continue to get the message out to the people that need it the most. And those are the young people that are, interacting with their children, interacting with their elders.
And then, Rashawn, can you talk a little bit about what the Black Nurses Association of Palm Beach County is planning as far as outreach efforts? I know when we spoke, you said maybe talking about going into the communities more and education being the key.
Oh, sorry, my mic was off. Yes,
Don't
we're
worry,
going
you're
to
in
partner
the hospital. I get it.
My mic was off. We're going to partner with T. Leroy Jefferson as well, and help them out in when we can, as well as educate the community on a daily basis, as well as going to the different churches in the community and educate more on that too as well. And with some of our pediatric nurses, we'll have them educate some of the church members, they church to the younger kids for the vaccine. And I know I have one of my friends that son has asthma, so she was happy that age went down to 13, because her son is now 13. So she was first in line to get her son vaccinated. She wanted him to be able to go to school and not wear a mask, when that time comes.
Now, in Tori's story, Doctor, you said we're worried about the younger people. We're starting to see more younger people. What did you mean by that? What age group are you worried about? Or are you starting to see?
I think that's for Dr. Camino.
Oh, okay. So using the statistics we have from the Florida Department of Health, specifically here in Palm Beach County, we know that almost a quarter of all our new cases of COVID are in the 24 years of age and younger group. So that would include our adolescents and our young adults. So that's why we feel it's important to try to market to as many young adults as possible the importance and the education regarding what COVID is, why it's important to get tested, why it's important to consider getting vaccinated. We know that a lot of these young adults, as we said, live with families, with other higher risk people. And so, this has to be a multi-disciplinary approach. As Dr. McCullough said, I mean, while we can set up a POD ourselves, and there's lots more doctors' offices offering the vaccine, I mean, it's going to take a lot more of a educational campaign, including social media, to try to target these young adults to consider getting vaccines because, now that we have that open to us, it's going to be an important part of solving this equation. So I think that's a big part of what we're doing in conjunction with other groups.
So I know,
yeah,
I know we talked a lot about hesitancy being real, and Arthur kind of touched on this a little bit, but it seems the hesitancy is real, but does it get more real when we talk about vaccinating our kids? And, Dr. McCullough, you talked a lot about listening to the professionals. Dr. Drayton, maybe tell me your plans for how you're going to kind of tackle this issue in the community as well. Because when we talk about kids, it's different.
Yes. Just last night, I had a dialogue, a conversation with a parent. Vaccinated, but she says not for her daughter. And that disconnect there, I couldn't bridge that gap. And everything I said, there was a repudiation and a rejection of it. So hopefully in time she will allow that to happen. But one thing that I've discovered is that young peers can reach peers a lot quicker and easier than I can. So a lot of time it takes a millennial who believe in being vaccinated to reach out to get other millennials and other age groups closer to them to receive it. And I think our job, my responsibility is to continue the education, but bring along like-minded, like-age persons of the same mindset where they can be a voice as well. They could be a focal point. Matter of fact, one of my godson worked closely with T. Leroy Jefferson. He's in med school. He's in the University of Florida now. And my mind is going, how can we procure him to be a voice, a moral voice for a younger person, his age group, to get vaccinated. And I think that's something there. I may be a millennial born in the wrong generation, but I'm not.
Terrell, are you having success with your age group? I mean, you're a college kid. Are your friends getting vaccinated? They're sort of this thing like, oh, I'm young, I don't need the vaccine. I'll be okay regardless of what happens. What are your friends saying?
Right. I think a lot of my friends, there is this mindset when we're young, we're invincible. We can take on the world, nothing will hurt us. And fortunately, in many cases, that is true when it comes to disease. Young people do a lot better than older individuals. But what we also see is that, it doesn't affect. And so I play college athletics, and, my teammates, some of the most in shape people you can imagine, they contract the illness, they contract the disease, and they recover, they're fine until a few weeks later, a few months later, they try to run again and their heart doesn't feel the same. They try to lift again and their lungs aren't working properly. And, the common question is, oh, we don't know the long-term effects of the vaccine. Well, I think, another important thing is that we also don't know the long-term effects of COVID either at the point. But what's really reassuring for me, and I think what helped me be convinced as a young person myself, is that the doctors and the people here on this panel, they're not discouraging questions. They're not asking for blind faith. They want you to ask your questions. They want to answer your questions, and they want to give you information and point you towards information that you can trust. So for me, my teammates, my friends, it wasn't about being lectured. It was about understanding that we're allowed to ask questions and that there are people there who can answer our questions, and that blind faith is not what's necessary. What's necessary is just being open and understanding that there are people out there that can help you. So that's really what helped kind of convince us, especially once you found this is really having an effect on me, not just now, but in the long term as well. So I think that's a really a good avenue for outreach as well. It's encouraging the question, encouraging more information, and encouraging these types of dialogues.
And just to point out, you're a legitimate athlete. You're a Division I college athlete.
Yes, I am. Or I guess I should say I was. My 4 years are ending in a couple of days. I was, but yes.
There you go. Just wanted to throw you that shout out. Is there anything, and this is really open for anyone here, but some people you're just not going to be able to change their mind, right? And either on lots of topics, but this topic in particular. So how far off is herd immunity? I mean, I know that's the $1 million question, right? But what do you all think? Are we inching closer? And this is for the medical professionals.
So I'll just start off by saying that there's a good chance we may not get to our magical 70 or 80% point that we would like to get. I mean, that's certainly possible. More than the is complacency that we see now. There's a certain level of feeling in the community that, we've got this thing under control, the cases are coming down, everything's going to be okay, we don't really need to wear masks in public. A lot of people don't feel they have to. And so, I'm concerned about the fact that, as Mr. Mondale brought up earlier, the Black and brown population of Palm Beach County remain disproportionately at risk for contracting COVID, and we see this. Dr. Tiffany McCullough and I, we are in the hospitals every day, and we see patients with COVID getting admitted every day, and certainly a good quarter of all the patients hospitalized with COVID are African American, which is a lot higher than their general population. So, so our concern is that while there is this feeling that we can sort of relax our guard, we don't want to leave our vulnerable populations behind, and so we're going to have to continue to mask wear, social distance, do everything we can until we get to the point where we can vaccinate as many people as possible. Because of that point that we may not hit exactly that magic number of herd immunity that you hear so much in the news.
Does anyone else want to jump in on that? Or Arthur, I saw you take yourself off mute.
Yes, because I wanted to know, doctors, when exactly do we get to the point where we treat this vaccine the way we may treat the flu influenza? Where someone just laughed. You know what I'm talking about. But then on the other side, because I'm going to give you two questions. That's the first one. The second one's going to be, you're going to still run into this population that has vaccine aversion. It's almost like a badge of honor. I spoke to someone today who said, well, I've never gotten a flu vaccine. I've never gotten the flu, so I don't plan on getting this one. What do you say to that kind of group?
So I'll just jump in and say real quickly that if there are people, and we know there are going to be people like that who don't want to get vaccinated, right? And you're correct. There are always going to be people who just feel strongly about it across the board. They've never gotten a vaccine as a young adult or as an older adult, and they never will now. But it's for that reason specifically, if you're going to be out and about in Palm Beach County in the next few months, and we're going to have the rules relaxed, you want to make sure that you are protected. Because remember, the idea of getting vaccinated is that you get exposed to someone with COVID, you're not going to be sick. You're not going to end up in the hospital, and you're not going to end up suffering some horrible complication, which we haven't even talked about, because we don't even really know what complications down the line are of COVID. I mean, this is the fact that there are people who don't want to get vaccinated would only prompt me, as someone who is around family and friends every day, to get vaccinated. And so I think that's the message that we just have to get across.
Rashawn, do you want to jump in on that? She's hard at work. I don't know. We can skip her right now. If anyone else wants to jump in on that, that's fine. Otherwise, I think, like, Arthur, unless you've got another couple questions, we'll probably try to wrap it up pretty soon.
I want to
want to say one thing.
Oh, go ahead. Yeah.
I'm sorry.
Oh, I'm sorry.
Rashawn, would you like to go first?
Yeah. Yes. What Dr. Camino was saying, I agree. Some people just be very adamant they don't want to take the vaccine because they never took the flu shot either. Like, prime example, with the young people, I have a 22-year-old son, and I speak to him every day about the COVID vaccine, and he would not take it. He said he's not going to take it till next year because all his friends, I talked to his friends as well, and they all at the mindset they want to wait. They're healthy. They work out just like the other guy did before me. But when they're older, they have their own mind. You can't make them do something they don't want to do. But like you said, too, you have to get the mindset of their age group. When they see other people do it, then they'll jump on the bandwagon and probably get the vaccine. That's what we got to keep doing too as well.
I'll say this, if I may. I've never received a flu shot in my life, but I've never seen a pandemic that's so ubiquitous and that's so worldwide and that has a death rate attached to it like this. One cannot afford not to take this vaccine. There's no way. I'm one of those individuals. I'm always healthy. I was a college athlete as well, not in my younger days. However, there's no way I could not get in line to take this vaccine. I've never experienced any pandemic like this in my life, and I'd rather be protected and protect those whom I love and receive my vaccine as I did.
All right. I mean, I think we've covered a lot of ground. What you guys might notice is we might get questions as this is posted on the PTV Facebook page. More and more people might comment and question. So it'll kind of, give you a sense. You just got a thank you from someone right there. So thanks for all this information. And I know that you guys are incredibly busy and we're hitting you midweek, right at work or right after work. So thank you so much for your time.
You're welcome.
You're welcome.
Thank you.
You're welcome.
Thank you.
Thank you.
All right, everyone.